Hello! It's been quite a while since I did this last time, but I've been quite busy, and I know it's kind of a stupid answer, but I've been busy and I've had my stuff to deal with. But I just want to sit down and have this little conversation with you to just update you about what I've been through and what I've done in the past months and where I am in my transition. One of the biggest reason for why I've been quite busy these months is because I got myself a puppy. Isn't she adorable, huh? Her name is Ellie and she is a Maltipoo, so she's a mixed breed between a Maltese and a dwarf poodle. And she is super cute and she's so small. Now she is, well, she's about 4 months soon. She has improved my life so much, and I still got my cat. Ronnie, come. It's not you. Another big thing that has happened in my life since my previous video is that the 12th of December I was back at the gender clinic for the first time since May, and this was also the first time that I spoke with the surgeon for top surgery. So this was just the first appointment, the consultation. So what basically happened was that I went into his office. We talked for like a minute before he asked me to undress and show my chest to him. And this was the point that I wasn't really prepared for it. I mean, this whole consultation appointment, I was so excited for it. I don't know why, I was just excited to kind of move on and being one step closer to top surgery. So I was only excited for this appointment. So it didn't leave me a lot of time to kind of prepare myself for showing my chest to a total stranger. But he was a professional, you know, so of course, so that kind of twisted my mind to a point of view that why should it do any harm? Like, yes, he's a stranger, but he's professional, so he has seen a lot of chests before mine, and yeah, it's no big deal at all. At least I thought it wouldn't be a big deal, but when I took off my shirt, I could literally see my heart beating. It was beating so fast. And it was kind of strange, but it went all fine. It was over in like a minute or so, and he just took a look at my chest, touched it a little bit, and he drew some marks around my nipple because the top surgery I'm getting is keyhole, and there were no doubt about that it was the right surgery for me. I was a little bit nervous before the appointment because I was afraid that I was supposed to be in the middle of two kind of surgeries, for example keyhole or periareolar and a DI, double incision, because I've heard stories about other people who's been in the middle, and I just don't want to be in that situation where I have to kind of choose. I basically just hoped for a surgeon who would just tell me that this is the right surgery for you, and I was really crossing my fingers that it would be keyhole. And he told me that it would definitely be keyhole, and he also told me that I didn't have any kind of loose skin, so they wouldn't need to kind of stretch it up again afterwards, because when you're doing keyhole, sometimes the results are like a deflated balloon kind of, but he wasn't worried about that in my case, so I guess I'm a very lucky person. There was also one more, I think she was a nurse inside of the room, and that was probably the most awkward thing about the appointment. She was just sitting in the back of the room with her computer and probably taking notes, but when I took off my shirt, she was also looking, like she was pulling her head away from the screen and she was like looking, and that felt kind of weird because I didn't quite knew what her role in this everything was, so it was just a little bit weird, but it went fine. So now I am on the waiting list for top surgery, and the surgeon said that most patients get their surgery in 6 months after the consultation. So that would be in like June or around June. But I also signed myself up on this list of people who can step in to get a surgery on short notice if anyone should cancel their surgery. So yeah, I'm kinda hoping that someone will cancel their appointment so I can step in, but we will see. I'm just very excited about this all, and it feels closer than ever. Will it be in June or will it be sooner? June is perfect for me as well, but I would prefer it to be sooner. I mean, the summer months, I want to have summer vacation without being too much bothered with having pain and these kind of things. So I am hoping for getting surgery before June. But June is also perfect. I mean, I'm not going to complain. And also now it is just 4 months, less than 4 months actually, until I hit my 2 years on testosterone mark, which is, it's insane. I have to say it is pretty insane. I'm probably going to make a 2 years on testosterone update video when that time comes. So yeah, you just have to wait and see if I've experienced any further updates than I've already said in my previous videos. With this video, I basically want to tell you that I'm in a very good place at the moment in my life, and I'm looking very, very bright on my future, and I'm very excited about all these things that the future has in store for me. So yeah, here's to the future. I also just want to say thank you so much to everyone who has been sticking with me for so long, who's following me on Instagram, sending me kind messages and asking about things. Please never stop doing that. I love to help people, so just keep them questions coming in, or if you just want to chat, send me a direct message on Instagram or something, hit me up. So thank you so much for watching my videos and this video, and I will see you again in my next video. Take care, bye.